We've talked a lot on the video blogs about how we're no longer using much in the way of CPAP in favor of using the BPAP devices or the bi-level devices that give 2 levels of pressure. And yesterday I had an interesting conversation with a colleague in Kansas. We happen to have a mutual patient through a number of means, and we got to discussing this particular issue, and I find it remarkable that even though we're not really communicating on a regular basis, he has come to the exact same conclusions we have about the failure of CPAP to work for so many patients because it produces pressure intolerance when you're trying to breathe out. And CPAP has just one level of pressure. If it's 14, it's 14 when you're breathing in, it's 14 when you breathe out. And I described for him the curve that we see. We have it on the blog at an earlier posting, showing these little blips along the expiratory, or the portion of the curve where the patient is exhaling. And you can see these blips where someone is literally fighting with that pressure. And that was the key reason that we switched most of our patients over to bi-level or BPAP therapy. And this pulmonary and critical care specialist in Kansas, who also does some work in sleep medicine, was mentioning they see the exact same thing, and that's why they're using much more of the BPAP therapy than CPAP. So it's interesting how other people, other aspects, other places in the sleep communities are coming up with the same thing. And what people often forget about this is that even though some who hear it think, gee, that's weird, why aren't people on CPAP? Well, there's actually a standard in the field of sleep medicine, a standard based on evidence that if you can show signs of pressure intolerance on expiration, then BPAP is the treatment of choice to switch over the patient to. So it's just, I think, a matter of course right now that not that many people are recognizing it and don't recognize that it is a standard. Because I think once they do, and once they see that, we're going to see far less people using CPAP and a lot more people using BPAP bi-level.